everyone. This is a great day for St. Francis. We're happy to have everyone here. I can tell you that I'm pleased to be able to talk about one of our outreach programs, which is the St. Clare Band. And we do it on a day where we pause today as an organization to provide some services for the uninsured. And in one way that we do that is through our St. Clare Band. It's basically a physician's office on wheels. It's been part of the St. Francis commitment to the community since 1992, providing health care to the homeless and uninsured in Wilmington and the surrounding areas. Through a model of patient-centered care, at St. Francis, we care for each person in the community, recognizing and appreciating his or her unique gifts, challenges, needs, and possibilities. The band and our other outreach programs reflect St. Francis's commitment to being a continuing, healing presence to all the communities that we serve. I look around this room and see many of our community partners that have certainly committed themselves to our charity care services. We're very thankful to have with us today County Executive Chris Coons, County Congressman Mike Castle, Senator Ted Kaufman, Senator Tom Carper, and I don't know if the mayor made it today, but he certainly supports us as well. We also have the support of members of our board of directors and our foundation board, and certainly our parent corporation and Catholic Health East. For years, the many important members of our community that are here with us today have advocated for us in our services, both here in Wilmington and also in Washington, D.C. The day-to-day operations over each of our charity care programs is relying on the financial support of individual corporate partners and sponsors who see value in the programs that we have for our community. AstraZeneca has been an integral part of the charity care programs here at St. Francis, and they have been so for years. Over the last several years, AstraZeneca has committed over $600,000 to our outreach and charity care programs. In 2010, they were committed again to strengthening the St. Clare Band services for those in the community whose medical needs might otherwise be overlooked. And I hope that many of you know, I think many of you do know, that with this gift from AstraZeneca today, we're looking to expand the services on the band. So we're thrilled to have a partnership with AstraZeneca. We have a representative from AstraZeneca. He's the Vice President of Corporate Affairs, and his name is David Nicoli. And so we're pleased to have him, and welcome.
You know, here at St. Francis, our Easy and Me prescription assistance program provides free drugs to families of four making up to $60,000 a year who don't have prescription drug coverage. So when you run into people here that don't have prescription drug coverage and need help, know that your neighbor is there to help your patients with that. Now at St. Francis, helping people find a medical home is pretty special, noble, and as I've said, truly inspirational. And I'd just like to commend on behalf of AstraZeneca St. Francis for the many years of providing excellent, compassionate care to a lot of people in Wilmington's underserved community. The announcement of this contribution to the St. Francis Foundation is really an illustration of AstraZeneca's view that a healthier world doesn't come about through medicines alone. It doesn't come about through doctors alone or hospitals alone, but it comes about through a collaboration and a shared commitment. In this case, helping good people without health insurance get access to the programs and services they need. Like you, we know the common good is best served when connections are made between patients, healthcare providers, nonprofit organizations, and the public officials that you see here today. So we've made an enduring commitment to supporting this incredibly valuable work that the St. Clare Band does, just as you have as well. I want to close by returning to an earlier theme, and that's really to make a difference. We all have to work together, to form connections, to form partnerships, all in the name of helping people improve patient health. So on behalf of everybody at AstraZeneca, Julie, I am delighted to present to you and St. Francis a check for $125,000 to help you and St. Francis support the underserved here in Wilmington. Thanks so much.
you very much. I can't top the $125,000, but I'll try my hardest. Good afternoon, everybody. I'm Oswaldo for those of you who don't know me, Medical Director of the St. Clare Outreach Program. For many years, St. Francis has been a beacon for so many uninsured in our community. They come to us with the compassionate care that has always been a hallmark of St. Francis. There has been so much change in the recent years, with so many people suffering hardships, both personally, financially, and so many uncertainties still to come. One of them being their health care and the ability to care for themselves and their families. With loss of jobs comes loss of insurance coverage. And for many people, it's simply not having a reasonable option for their health care, like basic health insurance or a medical home they can rely on. Take, for instance, our 62-year-old Caucasian man who's been coming to our service for over a year with multiple medical problems, including diabetes, high blood pressure, coronary artery disease, high cholesterol, not to mention a little bit of stress. This story is increasingly more common to us in the tough economic times. This is a hard-working, educated man who commits himself to architectural design. He was so unfortunate to have lost his job in the recent years. Along with it went his health insurance. He could not afford the cost of his consultation fees to see his regular doctor. He could not afford the cost of his medications, which were multiple. He came to us in a state of desperation, not knowing what would happen next. I remember him saying to me, "I've seen and known about the service, that you take care of people, and I never once thought that I would be needing it." I remember him saying that clearly. This is a more common scenario in our community, where the working poor find themselves struggling to pay their bills, find themselves struggling to support their families, and afford to pay for their health care on top of all of this. This is what encourages many people to ignore their health care, ignore their health problems, which only leads to other complications, as we know. Or take this other man, a 53-year-old man, who for the past 2 years has been living in the Sunday Breakfast Mission under a homeless work program. While he resides there, he had no idea that services were available to him to take care of his problems. He suffered for a long, long time with uncontrolled diabetes until he came to the van and we began treating him. His diabetes had gone uncontrolled for so long that it led to poor circulation in his legs, not to mention difficult to heal foot infections. All of this, unfortunately, led to 3 of his toes being amputated here at St. Francis. This was recently. He has continued to receive care with us. He was granted charity care through the hospital, and he eventually ended up with Medicaid and continues to use our service. These are just a few of the everyday stories that thousands of people receive medical care from St. Clare Outreach Fan. Without this service, thousands of people in our community would lack basic medical care and would rely on our emergency departments and our urgent care centers for their needs, obviously at a much greater cost to them and to the institutions that treat them. In the next month, with the support of AstraZeneca, we're planning to expand our van service to a full 5 days a week schedule with 2 stops each day. This will be at strategic locations throughout our community, locations where health insurance is least affordable, where there are a higher percentage of people that are uninsured. The van will also be equipped with electronic health records to assure better access to their health information throughout our hospital. The hope is that all members of our community will have the health care that they deserve. We're truly honored that so many people choose us as their main provider.